Welcome to your guide to gastroscopy and colonoscopy. Both gastroscopy and colonoscopy are different types of endoscopy. It involves a thin, flexible tube with a camera on the end that helps the doctor see inside your body to investigate symptoms and reach a diagnosis. A gastroscopy looks inside your throat and stomach, while a colonoscopy examines your large intestines and rectum. Both procedures will take around 30 to 45 minutes in total. You will be given intravenous sedation for the procedure. It is not safe for you to drive after the scope, as there may be remnant effects of the sedation. During the scopes, we are looking for any bleeding, polyps, inflammation, ulcers, and tumors. In general, gastroscopy and colonoscopy are safe procedures. The risk of perforation is 0.1 to 0.3%, and the risk for bleeding is 0.1 to 2%. Bleeding may occur when the procedure involves the removal of polyps or tissues for biopsy. In most cases, it is very minimal. Please clarify with your doctor if you're currently on any long-term medications or blood thinners, so we can advise you to either omit or continue your medications accordingly. You will be required to complete a bowel preparation before the colonoscopy procedure. The doctor may miss important things with poor bowel preparation, as the fiber or fecal matter may cover them. If that is the case, we might have to cancel the scope and reschedule it for another time. Then that would mean repeating the bowel preparation and visiting the hospital again. 3 days before your procedure, please ensure you adopt a low-fiber diet. Try to avoid any fruits, vegetables, and mushrooms. Besides that, red meat, grains, nuts, beans, cereal, oats, brown rice, milk, and cheese should also be avoided. You can eat simple carbohydrates such as white rice, white bread, noodles, and potatoes. Proteins will be fish, chicken, and egg. You can take coffee and tea without milk or creamer. Our doctors use 2 different types of bowel preparation medications, either Pico Prep or Fortrans, or both. It may not be the same for every individual. Please follow the instructions on the bowel preparation instruction sheet given to you. If you're using Pico Prep, mix 1 sachet in a cup of water and drink the mixture. After doing so, drink 1 liter of plain water over the span of about 1 hour. If you're using Fortrans, mix 1 sachet in 1 liter of water. Then drink the mixture slowly over a span of 1 hour. For example, if you're given 4 sachets of Fortrans, you will drink about 4 liters of fluids in total. You may experience abdominal cramps and feel the urge to empty your bowels halfway through or after you complete the preparation. It is expected for you to go to the toilet multiple times to clear your bowels. At the end of your preparation, the stools passed should ideally look clear and yellow without many particles. This will be a good indicator that you are done with the bowel prep. There should be no more food intake once you start drinking the bowel preparation medications. You are required to fast 4 to 6 hours before your scope, but you are still allowed to have small sips of water. You must bring along your admission envelope, which contains all the necessary documents, and your IC or passport on the day of the procedure. Please arrive at the hospital or surgery center at the designated time for admission. Do note that your procedure may not proceed if you do not bring your admission documents. The downtime for scopes is very minimal. If you experience any bloating or abdominal discomfort post-procedure, this may be due to the air used to inflate your colon by your doctor during the scope. It is normal and should settle within a day after some walking and parsing of wind. We will also cover you with 1 or 2 days of hospitalization leave on the day and the day after your procedure. Please reach our team at the various hotlines if you have any questions or need help.